Hello, everybody. Welcome, welcome. I am Melissa from Team Snuggle Bugz. I am with our marketing team. Some of you may recognize me from our social media channels and our YouTubes. I love to talk a lot, so alas, here I am again. But thank you so much for joining us on our Birthing with Confidence series. As many of you may know, our goal here at Snuggle Bugz is to instill confidence in families navigating the early stages of parenthood, and we have been cultivating a partnership with the womb for years. So the womb, they are going to be speaking tonight. We've got Kelsey, a pelvic health physiotherapist, who's going to come up and join me in a minute. But they offer whole wellness to women and families navigating pregnancy, parenting, birth. Angie's going to correct me in 2 seconds. But we've got the team here. They offer really holistic practitioners through their services, so I definitely encourage you to chat with them later. But Kelsey is going to be giving us a big talk about preparing for birth, the birthing experience, and preparing your body for kind of afterwards. So I know that this is, I'm sure for many of you, it might be first baby. I remember with my first baby, I was a little terrified about what labor would look like, how long it would last, how much it would hurt. And I remember this moment in the middle of my labor. It was peak moment. And I was like, what have I done? Get me out of this. Like, how can we claw back time a little bit? This is really scary. But really having that, just that strength of mind and that trust in your body to know that you can do this, you can achieve this, you can overcome this, and the best way to do that is to work through it. I know how much empowerment and affirmations really help in those moments. So I'm super excited for you guys to hear from Kelsey tonight. She's gonna have so many, suggestions and ideas of ways that you can prepare yourself physically and mentally for that process in a way that makes you go in feeling that much more empowered. So knowing how impactful that experience was for me, I'm excited for you to hear it for yourselves. So Kelsey is a mama of a 10-month-old, pelvic health physiotherapist in both the Burlington and randomly Woodstock area. But I will let her introduce herself further. Thank you so much for joining us tonight. We've got a whole packed event. I think you heard as you entered that we've got swag bags, we've got some giveaways later, we've got the Frida team here to tell you all about some special goodies that can really just help you on your path to parenthood. So without further ado, Kelsey.
Thank you. All right, thank you so much for that lovely introduction. And welcome, everyone. It's so exciting to have this big group. I wasn't expecting such a big group. And it's fabulous that you're here. I imagine most of you are here because you're either about to give birth, or maybe you're the partner or support person to someone who's going to be giving birth. So I hope that I can give some good takeaways and things that you can walk home with in terms of preparing yourself for that experience, because it's a pretty awesome, impactful one. So like was said, I'm Kelsey, and I work at the Womb, which is in Burlington, which would be nearest to here, but I do also work in the Woodstock location as a pelvic health physiotherapist. So a lot of what we do is help to prepare patients for their deliveries. We might help with concerns you're experiencing like bladder leakage or a heaviness or prolapse type of experience, maybe postpartum, any concerns you might be experiencing from your cesarean scar or pain with intercourse, things like that. So in terms of today, we'll mostly be focusing on preparing to push, and this is actually what I go over often with my clients. So I'll make sure I'm not in the way. All right, Angie. So today I want to cover some of the research on things like reducing your risk of tearing, which I know is a big fear for a lot of people. Tearing is something that's pretty scary for a lot of people who are pregnant. Also some birth positions that might help to optimize your birth experience, how you can open your pelvis when you're giving birth, and just kind of learning the role of the pelvic floor and how that relates to your birth experience. I kind of already introduced myself, but as I said, I'm a mom as well. So I have somewhat recently gone through all of this. I do have a 10-month-old at home named Oscar, and that was when he was really little. So I can relate to what you guys are going through, all of the fears, all of the aches and pains, all of the insomnia, the nausea, all of it. It's a tough time. I get the struggle, but you're about to be on the other end of it. It'll be really good and worth it. So at the womb, pelvic health is a really big component of what we focus on, and we do obviously offer other services, but we can move on. So I just want to quickly kind of overview what the pelvic floor actually is. So the pelvic floor is a group of muscles. The muscles sit in the base of your pelvis, almost like a hammock or a sling. So they attach from your pubic bone at the front to the tailbone at the back, and from your sitting bones on either side. So they just kind of fill the bottom of the pelvis. They also wrap around our urethral opening where our urine comes out, our vaginal opening, and our anus. So you can imagine, because they wrap around the vaginal opening, they play a pretty big role in our birth, but not the role that necessarily people assume. I think a lot of people assume that the pelvic floor actually pushes the baby out, but in reality, they kind of just have to stretch and get out of the way, and other muscles do a lot of the pushing for us. So when someone comes into the clinic, I'll just quickly kind of run through what we might go over. So typically the first half of someone's assessment, I quickly just go through what your goals are, what your concerns are, why you're coming in, a little bit about your bladder and bowel health, if you have given birth before, your birth history, any pain you're experiencing, any concerns you're having with your sexual health, and any questions that you have. And then we go through more of a physical exam. So often that involves kind of taking a look at your core muscles, your hip muscles, your low back, seeing how things are moving, your flexibility, your strength, that sort of thing. And then if you feel comfortable and you consent to it, then often we would do an internal exam. And the internal exam is the vaginal exam, which tells me kind of what's going on with the pelvic floor muscles themselves. So I wanted to go through today kind of what the research does show us about things such as how we can reduce the risk of tearing, different birth positions, pushing techniques, what pelvic floor muscle exercises can do, how we create more space in our pelvis, and the benefits of having continuous support during your labor. So tearing, we're often pretty obsessed about tearing. It's the number one thing that people ask me about when they come in for their first appointment, and the number one goal that people outline. They want to reduce the risk of tearing. And why are we so concerned about that? Well, tearing has an influence on pain. So we're more likely to experience pain after being discharged from our care. If we've experienced a tear, we're more likely to experience pain with intercourse, both at 3 and 6 months postpartum. We're more likely to experience incontinence or bladder leakage, bowel leakage. More likely to have infection, and also postpartum stress or depression, as well as inflammation. So I hope this doesn't make anyone like queasy or uncomfortable. So don't look if you feel uncomfortable by this, but these are the different degrees of tearing that you can experience. So a first degree tear is very mild. It's usually very well managed. It is also possible to not tear at all, but it's super uncommon in first-time parents. So a first degree tear just goes into the tissue at the vaginal opening called the vaginal mucosa, or the skin around that area, but it doesn't tear into any muscle tissue. Usually it's very well managed. You may or may not need stitches, but long term it's not too bad. A second degree tear would go into the muscle we call the perineum. So that muscle exists between the vaginal opening and the anus. And typically, but not always, you would need stitches for this. Generally long-term, pretty good recovery. And this is actually the most common as a first-time deliverer. You're most likely to have a second-degree tear. But nothing too much to fear. It is very manageable. Third-degree tears is when the tear goes into the muscle around the anus, called your anal sphincter. So it just goes partially through. You will certainly need stitches for this, and if you're under midwifery care, you're usually transferred to an OB to do these repairs. And a 4th-degree tear would go right through the anal sphincter. Generally, 3rd and 4th-degree tears are a little tougher of a recovery, and so these are the ones that we're hoping to be able to try to reduce your risk of mostly, because they do tend to have more of the concerns that we talked about earlier associated with it. So how do we reduce the risk of tearing? That's why we're here. So these are kind of some of the things that may help, and we'll go over each topic individually. So perineal massage, I'm sure you guys have heard of that before, a lot of people. Warm compresses during the delivery, perineal massage while the pushing experience is happening, hands-on versus hands-off with your provider, the person delivering the baby, different birth positions, and whether or not you have an instrumental delivery. So perineal massage, we'll start with that. So perineal massage, I will give a demonstration, not like a legitimate demonstration, don't worry, I'm not gonna drop my pants, but I will kind of try to explain perineal massage at the end, but I'll start with just kind of the research behind it. So perineal massage basically just allows the tissue to expand and stretch a little bit more easily when you're giving birth. Research shows that people who did this leading up to the birth, so the research shows to start it around between weeks 34 to 36, so generally around the last month or so of your pregnancy. Doing it, about every other day, 5 minutes or so each time. I'll explain again this a little bit more later. But the groups who did that, they tended to have a reduced likelihood of a tear that required stitches, and that was about a 9% reduction, which I know doesn't sound like very much of a reduction, but in research world, that's actually like a pretty significant change. It also reduced the likelihood of requiring an episiotomy, which is when the obstetrician would have to kind of cut the tissue a little bit to make more space for the baby to come through. So that was a 16% reduction, so that's quite significant. And generally, episiotomies are a little bit more tough to recover from compared to a natural tear. So it's great that it really does help to reduce that risk. The research on perineal massage shows the biggest effect in those who had not given birth before. So first-time parents will see the most benefit. And it had a really big reduction in people who experienced ongoing pain after they've given birth. So there was a 55% reduction in that. A lot of things that it doesn't necessarily influence as much. So I think a lot of people have kind of maybe false expectations of what it can do, but this is kind of what the research shows it can for sure do. We'll go over perineal massage with pushing. So perineal massage with pushing would be not you doing it or your partner, but it would be either your midwife or maybe the nurse or OB who is doing it. So that might be you're pushing for a count of 10, and then when you're in the break between pushing, maybe they're doing a little bit of stretching or massaging of the perineum. So people who had this had a higher chance of having an intact perineum, meaning no tearing at all, higher chance of that. This is low quality evidence. So when we look at pooling a bunch of studies together, the pooling of all of these different studies, it just ends up being low quality research, which isn't ideal, but it's the best we have. You also have a lower chance of those more severe tears, so 3rd and 4th degree tears, and that's actually moderate quality evidence, so that's pretty good. And then there is no difference in perineal trauma requiring stitches, 1st degree tears, 2nd degree tears, or episiotomy, but that's very low quality evidence. Warm compresses. So a warm compress, basically just like a warm washcloth or something along those lines. Again, it would be your either midwife, OB, or nurse who would do this for you, where they might take a warm washcloth, run it under some hot water, come back to you and kind of hold it over that area just to warm up the tissue and make it a little bit more flexible for you. So the research shows that you have an increased chance of having an intact perineum or no tearing at all. So people who did the warm compress, they had a 22.4% chance of not tearing at all. And people who didn't do a warm compress had a 15% chance of not tearing at all. So big increase. Warm compresses had a decreased risk of those third and fourth severe tears. So 1.9% of people who had warm compresses had a severe tear versus 5.8% of people who didn't have the warm compresses had a severe tear. And also, again, a lowered risk of needing an episiotomy. So 10.4% risk of having an episiotomy with the warm compress and a 17% chance if you didn't have warm compress. Another study also showed lower rates of severe tears, less pain during birth and postpartum, and lower rates of bladder leakage if you use the warm compress. Hands-on versus hands-off delivery. So a hands-on delivery would be when your obstetrician or your midwife is either supporting the tissue at the time of the baby coming through. A hands-off delivery is that they're just having their hands poised and waiting to catch the baby. So hands-off, on versus off, there was no difference in second, third, or fourth degree tears, no difference in the length that people pushed for, but the hands-off group, where the hands were just poised, had fewer episiotomies, higher rates of an intact perineum, and lower rates of pain, but slightly more first-degree tears, which is kind of a fair trade-off. First-degree tears aren't so bad. No difference in preventing severe tears in this study, and the hands-on actually showed a higher rate of third-degree tears. Now, this is something that you wouldn't necessarily have much control over, but it would be something that I would maybe chat with your provider about and just kind of see what their approach is, ask them what their preferences are. Generally, the research is one component, but it doesn't explain their clinical experience too. Instrumental deliveries. So are we familiar with forceps vacuum, that sort of thing? Some nods? Yeah. So obviously this is something that nobody wants to experience. Nobody wants to have a vacuum or a forceps delivery. Obviously sometimes they do help get the baby out. So generally the OB will not do it unless it's absolutely necessary, but they do increase the risk of more severe tears by quite a bit. So a severe tear, 2.8 in a typical birth percent, 18 to 25 if you've had a forceps delivery, and 11 to 16 if you've had a vacuum delivery. So it increases the risk quite a bit, and also can increase your risk of bladder leakage, bowel leakage, and sexual and pelvic pain afterwards. So not that you can necessarily change anything about this, but again, something to chat with your provider about, asking when they might do it, what their reasoning might be for it. And if you feel that you're in a position where it's unnecessary or you're feeling rushed, you can always ask questions like, do I have another chance to push, or is it imminent and we need to do this right now? So I'm actually kind of going through birth positions, the research on your tearing risk, but also kind of how it can affect your labor in general. So when we are laboring, when we're not quite at the pushing stage, but we're just kind of going through the motions of having our contractions come through, there's a lot of benefit of being in more upright positions. So that might mean walking around when you're in labor or bouncing on a yoga ball, that sort of thing. So walking or moving or being upright can shorten the duration of that first stage of your labor, which is from when you start to be in labor until when you start pushing, by an average of about 1 hour and 22 minutes. So it does shorten your labor quite a bit. And you're also less likely to experience a cesarean delivery if you've been more upright while you're laboring. In terms of the pushing stage, so this is something that's hard to compare people who've had an epidural to people who didn't, because you can't always get into the same positions. But what they found was for people who don't have an epidural, the upright birthing position, so when you're actually like pushing the baby out, being in more upright positions might look like squatting or on your hands and knees or kind of kneeling or even standing, kind of leaning over the bed. So it reduced the duration that you had to push for. It reduced the risk of needing vacuum or forceps. It reduced the rates of episiotomy, needing the tissue to be cut. It actually showed a slight increase in second-degree tears, which again, we're looking at the trade-off, like it might be better to have a second degree than a third or fourth. And no difference in a lot of other factors. There was a later study that came out that did show a reduction in third and fourth degree tears too if you birthed in an upright birthing position. This is without an epidural. If you had an epidural, the research isn't quite as clear, and possibly that's because it's not always very easy to get in more upright birthing positions when you are numb. So what they kind of found was that there wasn't a lot of trends towards your rates of tearing, your length of pushing, that sort of thing. So it didn't show too much, but then there were some later studies that came out, I believe, if you go to the next slide, Angie, that being in what we call a flexible sacrum position, so your sacrum being the triangle-shaped bone at the base of your spine, flexible, so not lying basically directly on that area. So if you're lying on your side or if you're able to get onto your hands and knees, these flexible sacrum positions showed a lower rate of needing vacuum or forceps, cesarean birth, an episiotomy, severe tearing, and severe pain, and shorten the duration of the active pushing. So that's a bit of a newer study that had come out showing that. So ultimately, if you go to the next slide, in terms of these upright positions, the reasons they may be beneficial, we're using gravity in them, so gravity can help to bring the baby down and out. There's less risk of putting some pressure against some of your main blood vessels that might happen when you're lying on your back. So you tend to have more normal heart rates of the baby and lower risks of cesarean. The uterus can contract more strongly and more efficiently when we're in upright birthing positions. It's easier for the baby to get into a better position to pass through the pelvis, and it's generally a bit more well tolerated and a little comfier than being on your back for some. But ultimately, because the research is a little bit mixed and some studies are showing one thing, some are showing another, generally what I say to my clients is try to choose the position that feels best to you. That's the most important thing. And try to advocate for yourself if you're not able to be in the position that you'd like to be in. You can ask to try to change positions, and that's totally fine. Okay, opening the pelvis, so how we go about doing that. So our pelvis, I kind of wish I had my little model here that I have in the clinic, but our pelvis has kind of two main areas that the baby will have to pass through to exit. So if we kind of are looking at our pelvis like down through it, we have what we call our pelvic inlet, which is like the ring at the top of the pelvis through here that the baby has to go down. And then we have what we call our pelvic outlet, which is like the bottom part of the pelvis, the ring at the bottom. So when we're in kind of our early laboring stage, we want to do things that help the baby get in through the pelvic inlet to get into your pelvis. When we're pushing, we want to get past the pelvis through the pelvic outlet to exit your body. So when we're kind of laboring, when we're in earlier labor, we want to be in positions that help bring the baby down. So that's going to be, again, those upright positions. Gravity can help bring the baby down. Getting into like really deep low squats if you have the flexibility to do so. I know it's not as easy when there's a bump there. Doing things that open your knees, open the pelvis up that way, and really doing kind of like asymmetrical movements actually helps quite a bit. The analogy I usually use to describe that is if I'm trying to take off my ring and I try to pull it off, I usually can't pull it off just like this. I have to kind of move it side to side and do these asymmetrical movements to get it past my knuckle. And the same thing goes for your pelvis. So if we move our pelvis kind of this way, then the baby has a better chance of getting down lower into the pelvis. So if you've heard of, I'm sure you have, like TikTok talks about this a lot, but curb walking, yeah, it's familiar. So that's when you kind of have like one foot on your curb or sidewalk and the other foot down below. And you might see pregnant people kind of walking around like this. But that's kind of getting that asymmetry in the pelvis, so those movements will help get the baby down lower. And just changing your position often. So I know it might feel tempting to just get comfortable and curl up into a ball on your side, but the movement, like any sort of movement, is going to be good, even just walking around. And then when we're actually pushing, this is the most mind-blowing part. It's not always the position that you see in the movies that is the most optimal for creating more space through the bottom part of our pelvis. So what we see in the movies usually is a woman kind of lying on her back with her legs spread out as wide as possible, and knees are kind of cocked to the side like this. What actually can be a bit more beneficial is when we have our ankles a little wider than our knees. I don't really want to do a demonstration, but I kind of want to too. So if you're lying on your back, rather than having the knees out like this, you would have them kind of more narrow than the ankles. So the benefit of this is that our sitting bones, when we go into that hip internal rotation, which is this way, the sitting bones widen. They come apart from each other, compared to when we're going like this, the sitting bones come closer together. So it's just a really subtle tweak. You can still have your legs apart, but you just want your ankles a little wider than the knees if possible. And then we talked about those sacrum freeing positions, so potentially not being on your back if it doesn't feel comfortable, considering maybe being on your side, hands and knees, that sort of thing. Pelvic floor muscle training. So obviously this is a bit of my bread and butter, but I was excited when I first started researching this back when I became a pelvic floor physio, that there were actually some benefits aside from just bladder leakage that would help people who were pregnant. So the research shows that people who train their pelvic floor regularly while they're pregnant tend to have a shorter first and second stage of labor. So less laboring, less pushing. Pretty good odds. And they also tend to have lower rates of those more severe tears as well. And then, as I mentioned, they're less likely to experience bladder leakage, but not just while you're pregnant, also even after the baby's born. Even if you didn't do the training after, but you just did it when you were pregnant, you're less likely to experience it after as well. And pushing techniques. So this is kind of the wild, wild west in terms of research. I won't bore you too much with the research side of it, but there's different types of pushing techniques that you can do when you're trying to push the baby out. One is what we call open glottis pushing. Your glottis is the throat. Open glottis would be either breathing while you're pushing, so or shouting while you're pushing. That will have your glottis open, versus a closed glottis push would be you're holding your breath and you're kind of bearing down as hard as you can. There's also another kind of category of pushing techniques. One is called spontaneous pushing. So this is pushing based on your own cues when it feels right to push during your contraction, versus directed pushing, which is when your nurse, your OB, your midwife is maybe counting for you, telling you, go, 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 count for 10, that sort of thing. So the research on both of these different types of techniques didn't really show anything. I'll summarize it. It didn't show too much. No difference in tearing rates, no difference in the length that you're pushing for, that sort of thing. One small tidbit that I will add is giving birth vaginally is a risk factor for developing something called prolapse, which is when one of your pelvic organs, like your bladder, uterus, or rectum, descends downwards towards or past your vaginal opening. And that is more likely to happen when we've been doing holding our breath and straining. Constipation also can make you more likely to experience it because we often do that hold our breath and strain. So from that perspective, there may be benefits to trying to either breathe through the pushing or yell through the pushing, but there's not a lot of research on this, so ultimately don't worry about it too much. You probably won't even be thinking about any of this when you're pushing anyway. There's also another category of pushing technique, which is delayed versus immediate pushing if you have an epidural. So some people will start pushing as soon as they become 10 centimeters dilated, and some people will try to wait until they feel an urge to push. Not everyone feels this urge. So you're taking a bit of a risk by delaying and waiting, but there is some research that you're pushing for not as long if you wait to push. And you have a slightly increased chance of just having a normal vaginal birth versus needing like a C-section or something. But ultimately not like huge findings there. And then continuous labor support. So continuous labor support would be having someone there who's able to support you through your entire labor, who's knowledgeable about how to support you, who is not leaving and coming back the whole time. Typically, a doula is a really good option. We could also have someone who's really well trained to support you, a partner, if that's not in the cards. So people who had continuous labor support were more likely to have a spontaneous vaginal birth, like a normal vaginal healthy birth, and less likely to report negative feelings about their childbirth experience. They're less likely to use medications during their labors, less likely to have long labors, less likely to have a cesarean, forceps, or vacuum delivery, less likely to have a baby with a low APGAR score, which is just a way of measuring the baby's health when they're born. Oops, was there one more? With regards to kind of having that continuous support, I think the main thing is that the reason it's so beneficial is that when you have support, you tend to feel more safe and supported and secure during your labor. And those things really influence our hormones, our oxytocin, which helps our labor to progress better. So if you have that feeling during your labor where you feel really safe and supported and at ease, despite it being a lot, that's kind of a huge win. Awesome. So yeah, we'll use this last little bit of time. So we're well over halfway. Don't worry, I won't stay up here too much longer. But I want to just kind of go over like practical stuff that you can actually take home with you of how you can actually prepare. So we'll go over kind of like how to train your pelvic floor, how to do pelvic floor exercises, as well as I can explain just by saying it. It's kind of one of those things that it's a bit easier to understand when you're experiencing it, but you can do your Kegels along with me. We'll go over kind of how to do perineal massage, when to start it, like all of that stuff. And we'll go over practice pushing and how, even though the research doesn't really show like exactly how to do it, we'll go over a little bit more information about that. So I don't really have slides for this, I'll just be chatting. So for pelvic floor exercises, so I'm assuming everyone has heard of a Kegel exercise before, yes? Yeah. So what I usually tell people is that the exercises that you do for your pelvic floor might depend a little bit on your personal situation. There's not really like a one-size-fits-all pelvic floor exercise, but I'll give you kind of an example of like the average person, what they should be doing with their pelvic floor. And if you have any specific issues, obviously maybe consider seeing a pelvic floor physiotherapist yourself. So when we're doing pelvic floor exercises, it's not just like tighten Kegels all the way. There is a component of release with that too. So our breathing, our mechanism, like our diaphragm, our core, and our pelvic floor all kind of have to work together as a team in order to do a proper pelvic floor exercise. So typically, the way that I teach it is that as we breathe in, we're breathing in, air is filling into our lungs, our diaphragm moves down. You're not consciously making it move down, but you are thinking of your belly rising as your diaphragm moves down. And as that downwards pressure comes through the diaphragm, our pelvic floor should actually like relax. It should lengthen or expand a little bit. So as we're breathing in, the pelvic floor is opening, dropping, and relaxing. And the way that you might experience this feeling, maybe you would open, drop, and relax when you start to pee. So it's that feeling of like letting everything drop down and go out. So breathing in, opening, dropping, and relaxing through the pelvic floor. The way that the muscles are, they kind of do like this motion. So they squeeze and lift when we tighten them, and they drop and open when we relax them. So if you see me doing this with my hand, that's kind of what I'm doing. Breathing in, opening, dropping, relaxing the pelvic floor. And then as we breathe out, we reverse all of that. So breathing out, the diaphragm is lifting as we breathe out because our lungs are shrinking. the pelvic floor can move up with the diaphragm, so we squeeze and lift. So the feeling you might have when you're squeezing and lifting through the pelvic floor, it might feel like you're picking up a marble with your vaginal entrance. It might feel like if you were peeing on the toilet, you made your pee stop midstream. It might feel like your sitting bones drawing together. Maybe like your tailbone is curling up inside. Those are kind of some of the common cues that we would go through to facilitate that tightening and lifting through the pelvic floor. So try, as we're talking about, try seeing if you can do it in your chair. It might be difficult. Like for some people, it's quite difficult to initially do it, and not a lot of people have like a strong skill set right away, especially a bit harder when you haven't given birth before. So practice that. Breathe in through your nose, feel the muscles drop and open. I'm doing it too. Breathe out through your mouth. You're gonna squeeze and lift up into that Kegel. So those are pelvic floor exercises, Kegel exercises, whatever you wanna call them. And I like doing it that way because if your muscles are tight, you're still relaxing them. But if your muscles are weak, you're still strengthening them. So you're getting a little bit of both. So it's kind of like a bit of a generic exercise, but it should fit most people somewhat well. Generally, I recommend doing this for about 10 repetitions. So breathe in, relax, breathe out, and tighten is 1 repetition. Going through that 10 times, 3 times per day. So you could do it all 3 at once before you go to bed, for example, or you could do it like morning, noon, and night. And yeah, there's kind of benefit to doing it in all sorts of different positions. So maybe practicing it when you're in bed before you go to sleep, maybe practicing it when you're standing in the shower, maybe you're in a meeting at work and you can just like do some Kegels while you're not paying attention to the people that you're working with. So they're kind of like a really versatile exercise because you can literally all be doing them right now and I would never know if you're doing it properly, unless you're like kind of making a funny face like this. So yeah, you don't have to be like doing a specific workout necessarily. I think a lot of people come to me being like, oh, I've been doing my pelvic floor exercises like this one and like the glute bridges and stuff. I'm like, no, like it's not that complicated. You really just have to do like the specific pelvic floor ones and not like full body exercises. Although those are really beneficial too. In fact, research shows that people who generally like meet the exercise guidelines, so doing like 30 minutes of exercise 5 times a week-ish, tend to have faster labors as well. So keep up with your walking, your yoga, your, whatever you enjoy doing, weightlifting, all of that stuff, because that's really beneficial too. Any questions about pelvic floor exercises? That's all good? Okay. And I'm sure some of you who have seen a pelvic floor physio before, you know. Perineal massage. So we talked about the benefits of this in terms of reducing your risk of tearing and pain postpartum. So perineal massage, as I mentioned, you usually start in the last month of your pregnancy. So like if you're super keen, you can start before, but usually I tell people like don't start too early because you're probably going to get burnt out from doing it. Like it's not like the most fun thing ever to do. So you don't want to get too keen at the beginning and then get tired of doing it by the time it actually matters at the end of your pregnancy. So yeah, usually 34 to 36 weeks because you don't know exactly when you're going to give birth. So give yourself a month or so. So generally we can either do it on our own if we can reach, which not everyone can, or we can enlist the help of a partner if they're willing to help out. So if you're doing it on yourself, what I usually suggest is kind of like having a little setup for when you go to bed at night is usually the easiest. So maybe having like a little bit of lubricant on your nightstand or like coconut oil is usually really nice to use and smells better. So have that kind of set up on your nightstand and rub some on your fingers. If you can reach this way, that's usually what I recommend. So lying on your side, a little bit more comfortable when you've got a big bump at 36 weeks. You can insert one finger vaginally to start. I'm going to try to not to demonstrate this too much because I'm going to get embarrassed, but insert one finger vaginally to start kind of from behind so that the bottom of your finger is facing like towards your tailbone. And then if that feels like it's tight already, just stick with one finger. If it feels comfortable enough, then usually I tell people to just slide the second finger by its side. So you've got 2 fingers in this way, lying on your side. And then you're doing that breathing exercise to relax the pelvic floor. So you're breathing in through your nose, your belly is rising, your pelvic floor is dropping and opening. And as that's happening, you're pulling like back towards your tailbone, holding for a count of like 3 to 5 seconds. Then you're exhaling and releasing the pressure. And you can do it then kind of on an angle, so you're pulling more towards like your sitting bone, holding that for a few seconds, releasing it, and then you would pull towards the other sit bone, doing that as well. So doing that for a few minutes, just kind of going through the breathing, focusing on releasing and relaxing through the pelvic floor. And then you can even add in like a little bit of a U-shaped stretch. So you're kind of going like down and around the bottom half of the muscles down there. Or what we call a peace sign stretch. So you're like pulling down and opening your fingers apart. So you're stretching both sides at the same time. So total, like 5 minutes is fine. You're gonna get bored of it pretty quick. You don't have to do it too long. And like usually I tell people daily because I know they won't actually do it daily, but like every other day should be totally fine if you really commit to that. If your bum is not as flat as mine and you can't reach that area this way, then you might want to ask for some help from either a partner, or you might want to like buy like a wand or something that you can use to help you reach around your belly or from behind. So partners who are helping you out, it's pretty much the exact same thing. Inserting one finger vaginally, bottom of the finger down towards the tailbone, 2 if you can. Try to be, I find partners either are like way too gentle and delicate or like way too aggressive. So like find that middle ground, get some feedback from your pregnant partner, and then you're gonna do the exact same thing I said. So you're pulling down, holding for a few seconds as you're gonna feel like the pelvic floor relax a little bit. So you'll feel that you can stretch a little bit better as they breathe into it and relax. And then you'll release as they exhale, and then kind of work to the side, the other side, so that you're kind of getting that full bottom half and working on the stretching. So it's not really a massage. Like it's not like a massage like this. It's like more, I would just call it stretching, if anything. And yeah, so that should be helpful. Is there any questions about perineal massage? I'm trying to think if I'm missing any key info. No questions there? Good, okay. And then pushing. So sometimes when people come into the clinic, we actually go over like practice pushing techniques because it's kind of a hard thing to just like describe to someone, just like a Kegel is. It's a little bit easier to just give people real-time feedback as they're pushing. So I can kind of communicate, okay, like that was pretty good, or here's where we can change it up a little bit. I always laugh so we talk about kind of like how to push, but every once in a while, I'm going to do a practice pushing session with a client, and we're getting all ready and they're about to push. And then I'm like, okay, give it a try, like see what you think. And then they do a Kegel. So a Kegel is really like squeezing and lifting my fingers inside. I'm like, whoa, okay, no, we don't want to do that. We're going to pull the baby back in, and it's going to have the exact opposite effect of what we want. So make sure you're not doing a Kegel as you're trying to push your baby out. It's going to make it much harder. So for pushing, we talked about how you can either like breathe through it, you can hold your breath through it, you can yell, shout through it. Unexpectedly, I was a loud shouter when I gave birth. You just never know who you're going to be when you give birth. And then you can either kind of like push when it feels right, or you can kind of be coached through it by your provider. So either of those things are fine. Often what I say is we're going to start by like taking that deep breath in to relax the pelvic floor. Because remember how earlier I mentioned that the pelvic floor doesn't push, it has to like relax and open to allow a baby to pass through, right? So we want to set the foundation by getting the pelvic floor relaxed before we push. So we're getting ready to push, we do that, breathe in, open, drop the pelvic floor, create some space, and then as we go to breathe out, we go, and we're sending all that energy straight down and out. For some people might yell, but straight down and out. Some people might and use all their force downwards. And usually in my practice, what I do is I try all three with people and see what elicits the most movement for my fingers, like what moves my fingers out the most, and give them that feedback so that they kind of know about that. Doesn't mean they're going to use it at all when they're actually giving birth, but it can be helpful to kind of know what works well for your body. We also usually practice like both on your back and on your side. Some people are really ambitious and try with getting some feedback from me like on hands and knees and stuff. It's not easy to do, but some people are adventurous and we try it. So we can get some feedback on what positions you tend to push a little bit better in. And that can be helpful going into it. It might save you some time if you're really good at pushing on your back, but not on your side, or vice versa. And then the other thing I really, really recommend if you're up for it when you're pushing is, especially if you have an epidural, is use a mirror. So I know a lot of people are like, oh my God, I could never look. But the mirror provides really good feedback for what you're watching, and it's really motivating. So sometimes like your nurse or your midwife will say, okay, push right here, and then they'll tell you. And often it feels like they're like, you're doing great, just keep going. And you just feel like you're making no progress. But the mirror, you can see exactly what's happening. And you can see, okay, I'm pushing and I see the head starting to crown. And I can see, as I stop pushing, the head kind of comes back inside. And it really brings out some motivation to kind of like hold that pressure. It's kind of like you push, push, push during that contraction, but when the contraction is over, you don't want to let it all come back inside. You want to keep that pressure down and then keep pushing through the next one and building on each contraction rather than just coming back and forth the whole time, if that makes sense. And it's also like, in that last push, it really just gives you that drive or energy to get the last little bit of effort out to get the baby through. So if you're willing to, I really recommend pushing. I know a lot of my clients say, it's not for me, Kelsey, and that's fine. But I do think it gives some really good feedback if you're willing. So that's kind of pushing. Again, I know it's kind of hard to explain until you've been there. Some people would describe it like feeling like they're pushing while they're constipated, like pushing a poop out. Some people say that's exactly not how you should push. So everyone's cues are a little bit different. It kind of varies person to person, but yeah, it's nice to be able to get a little bit of feedback, even if it's just from your nurse or your midwife or someone like that. When you first start your pushing, you can get a little bit of feedback that way too. I do have a little handout that I made that just kind of summarizes everything we went over, but we don't have it printed. So if there's somewhere where we have like everyone's emails, then I'll just like send it to you and you can pass it on. But yeah, it's just like a quick little summary of like all of the research that we talked about today. I have like a physio social media. I never go on, I'm the worst, but I will check it. Like if anyone DMs me, I will check it. So feel free to reach out if you have any questions as well. And I should just say too, like none of this is medical advice. So anything that I'm recommending, always talk to your OB or your midwife about before you start participating in it. Thank you.
Okay, before we have our Frida team come up, I know in my personal experience, especially with baby number one, I was all about taking in all of the information I could possibly get. But giving birth is such a personal journey. I know I had some friends who were like, I just want to go in and be told what to do. I don't want to overwhelm myself with information. Whereas I was the type of person, I made my husband sit beside me. We watched a YouTube video of every single different way that you could give birth. So we watched a hospital medicated birth, an unmedicated birth, a cesarean, because I was like, I need to be prepared for all possible outcomes, because I definitely understood that when you have a baby, it doesn't always go according to plan. And giving birth is your first slap in the face of that lesson in parenthood. But at the same time, that really helped me. Some of the other things that really helped me, preparing my body, I cannot emphasize enough to Kelsey's points about staying active and, taking on some specific exercises that help you with, just opening your hips more, preparing your pelvic floor for birth. Those were major tools that I had in my toolbox going into labor. So a bit about my experience. I had two unmedicated home births with my kids. The first one was probably an 8-hour labor. The second one was a 15-minute story, which is a whole thing. But definitely being prepared going into it. So for me, it was about educating myself about all the different ways that this could go. It was about talking to my midwife team. I had the luxury of having Nicole, who's at the back there. She is part of the Snuggle Bugz team, but she is also a doula. And being able to have a resource like that where I could ask questions and get advice from leading up to the birth was such an invaluable resource. So I definitely encourage you, we live in a world now where we have so much more access to information, even on social media. Oh my goodness, I don't know how people parent. Sounds terrible, but like, how did they get all their parenting intel before social media? Like, I follow all of these accounts and it's like, okay, this is how we're gonna do sleep, this is how we're gonna do potty training, and I've got my other person that I'm following for behavioral things. It's very helpful. There's so many resources available to you, so I definitely encourage you to take advantage of them. I know one other random way that I prepared for birth was I read a lot about hypnobirthing because I knew that I wanted to do an unmedicated home birth. That was kind of my ideal goal. I didn't know if it was going to turn out that way. I'm not a hippie, I promise. But at the same time, I knew that that would be a really helpful tool in my toolbox to get me through that experience. So, leverage the resources that you have available. Look at your community, getting advice from, friends and family members, and just hearing birthing stories was so impactful for me because so many people come out of it and they're like, I had no idea, or the number of friends that I had who had an unplanned cesarean and it was very shocking in the moment. That was really helpful feedback for me to learn from other people. So I was like, I might have this plan, but I should really figure out what the other options are or how things might go in a different direction so that I'm more emotionally prepared for that. So that's just, my 2 cents as a humble marketer, but also working in the baby space for 8 years now. So I really, I have access to all of these incredible resources and the resources that the womb offers, and just learning from those providers and taking advantage makes a huge difference. Speaking of things that make a huge difference, 5 years ago when I had my first baby, I'm on baby number 3 now, so that was a while ago. 5 years ago, Frida Mom was not on the scene yet in Canada. I remember a few months after I gave birth, they started launching some products, and I was like, that would have been nice to have. And now, then when I had my second, who's now 3, I was able to really take advantage of their product assortment. So this is not intended to be a sales pitch, but speaking of resources that are at your disposal, Frida Mom offers so many products that are geared towards mom, the birthing experience, whether that's a vaginal birth, a cesarean birth, whether you're in kind of the prenatal stage or in the post-birth stage, and they can really impact your journey in terms of your readiness or your healing afterwards. And so they're gonna come up and talk to us a bit about their products. We did secure a special deal tonight, so 15% off Frida, and then we have some stuff out if you guys want to shop after, but Frida will come up now. Once Frida is done, I'll do a quick draw, and then you guys are good to kick it, but don't forget your swag bags on the way out. You'll see me one more time. I'm going to introduce Amy and Daniela now from the Frida team.
Hi, everyone. Can you hear me okay? Testing. Hey.
Testing.
Well, thank you, Melissa and Kelsey, and everybody at Snuggle Bugz and the Womb for letting us join this event. We're very happy to be here and talk with you all. These events are kind of where and why Frida exists, continuing the conversation and providing parenthood solutions is why Frida was founded, and why Frida Mom was born was because no one was really looking after mom. Mom had to run around the pharmacy and all different kinds of aisles trying to meet her needs for postpartum care. So Frida Mom was made to fill that need. Where was it?
One of the key pieces that I want to point out is everybody in the room is about to birth a baby at some point in your journey, but also with that is born a mom. And whether that's a birthing parent or a mom, by definition, that is the number one person that we're here to take care of. And it was a blessing to hear from the womb and that experience in preparing for all of the things, the scary things, those scary realities that are about to happen. And everyone's journey is going to be completely different. And the products and the things that you're going to pack in your hospital bag are likely in your mind and really cute and really small and all for that little baby. But the reality is there's got to be a little toolkit for you in preparing for that postpartum recovery. And it really starts right in the hospital after delivery. So we're going to take you through a couple products that are key to those recovery moments. And we're going to talk about vaginas and discharge and blood clots, and that's okay. It's a safe space, and those are just the realities of this time in our journey. So
between the two of us, I've had 2 C-sections, and Danielle has had 2 vaginal births. So between the two of us, we've got you covered on experience in that area.
And very different experiences among all 4. So, and would probably do it again, but not going to.
So there's lots of products. There's products geared towards C-sections. There's products geared toward vaginal deliveries. But there's 3 key products that no matter which way you give birth, you're going to need. The first of which is, if you want to Vanna White for me, is a peri bottle. Who here's heard of a peri bottle before? Oh, good.
Who's here has sat on a bidet?
Okay,
So,
great.
Imagine a bidet on the go. So different than the peri bottle that the hospital might hand you in the delivery room. It looks like, if anyone's ever seen it before, even if you've had any perineal operation or treatment, it looks like an old school ketchup bottle. Water fires out of it like a fire hose. It is not gentle. I remember my scariest moment post-birth was having to go to the bathroom for the first time, because I had a 2nd-degree tear the first time with my first, and it hurt. And I was really sore, and it was terrifying for me to have to walk into the bathroom and wipe, because it was such a sensitive area. And out came my peri bottle, obviously the Frida Mom peri bottle, and the nurse looked at me and she said, "Oh, you're a Frida Mom." And I said, "Yeah, I am." And I handed back her peri bottle. And what's so unique about this one is, I'm actually going to demonstrate it because I think it's so important. But when you're sitting on the toilet at a 90-degree angle, this peri bottle here actually sprays the water up. So if I'm sitting on the toilet and spraying the water up, it's gently splashing the area that needs to be cleansed. If you had a C-section,
Yes.
Amy,
Yeah, a lot of people think you're not going to need a peri bottle if you've had a C-section, but obviously, personal speaking, you definitely need one. You don't want to be contorting your body on the toilet after you've had a C-section with a glorified ketchup bottle. What you want is something where you don't have to bend and twist to be able to clean yourself, because you still have discharge after you've had a C-section. So you're still going to have blood clots. You're still going to have the need to clean yourself in a comfortable manner. So a peri bottle, no matter which way you give birth, is imperative. Number 2. Do you want to take one? I'll take it. Okay, so disposable underwear. Disposable underwear is also a must-have. You're not going to want to take your own underwear to the hospital. You don't want them to get destroyed or stained, or they also don't feel as comfy. Disposable underwear from Frida Mom is, you'll feel it after you come by the booth, but it's very, very soft. They're extremely stretchy, and they come in 2 different cuts. One is a boy short cut, and one is a high-waisted sort of brief.
Yeah.
One is marketed more towards a C-section. One would be more for vaginal birth, but honestly, speaking from experience, they both would be fine for a C-section, because they would cover your incision line. Your incision would be right above your pubic bone, so either one of these options is going to work for that. So it really just kind of comes down to personal preference of cut that you'd like.
one of the key pieces on the underwear is that it's got a big crotch area, and like we mentioned, there will be like a period, menstrual bleeding. Although the substance that comes out is a lot thicker, you could be passing clots. It's not as liquid, it's not as thin, it's a lot denser in blood. And this will hold a pad, which we'll show you next. But this has got a very big crotch area, which will be suitable for whether it's the first pad that the hospital will give you, and then after that, they'll either, depending on the hospital you deliver in, they'll ask you to pay for the additional items, or they just have expected for you to have your own. Just like an underwear. The underwear, post-delivery, generally a hospital will put you in a gauze pair of underwear. But again, if anyone's ever put one of those on, the first tear of a pad coming out of that, the underwear is ripped. Because it's a very thin cheesecloth-like material that isn't meant to last more than one change.
They're also not very cute. So if you want that postpartum selfie, it's not going to be great in hospital underwear. Okay, and then as Danielle mentioned, we have postpartum pads. So these are called the Frida Mom catch-all pads. And what makes them different than an incontinence or a period pad is that they have a gusset. So why would you need a gusset, I wonder? So when it comes to incontinence or period blood, it's a much more liquid-based discharge. Postpartum there's a lot of clotting, which is not as easily absorbed. So if you have a pad that has a wing or no wing, a clot could easily slide off of the pad. This has a gusset which will catch whatever comes out. That's why it's called a catch-all pad. And it has a nice long length for nighttime, laying down, whatever. It's thin, but it's super absorbent. Another thing with incontinence pads is that they're sometimes really thick. They're I was talking about how they kind of feel like you're sitting on a pool noodle sometimes because they're these thick cotton pads that are just really uncomfortable. I'm assuming as long if you've had a vaginal birth, it's not really comfy to sit on. So these are perfect for specifically postpartum.
These are the top 3 items that we recommend for every hospital bag, any mom delivering either vaginal or cesarean, because you need them regardless. Frida Mom does a whole extended line of C-section specific items. They've got a belly binder, which provides compression and support post-delivery. They've got breast cooling pads, and there's various items that are available. We can take you through any of the products you might have questions on. Again, we always recommend adding these items to a registry. Your friends, your sisters, your peers, your community, a lot of people have become familiar with the brand and the products and the need, and we often forget about ourselves and adding those items to registries. And whether it's a baby shower or just any gift, it's really fun to open up something. The marketing and the branding around this brand is brilliant. It makes you feel fun and accepted and comfortable versus medical and clinical and,
not very
painful.
personal.
Not
Yeah.
as personal.
Yeah. Keeps it fun.
Yeah. So that's what we've got for Frida. There's also a ton of Frida baby items, which we do, and that was really where the brand was born, on the original snot sucker. And yes, it truly is a snot sucker, but it will be your lifesaver in the middle of the night when whatever age baby is stuffy and can't blow their own nose. We can take you through that next time, but that's it. We're happy to answer any questions, or feel free to come over. Some of this stuff is a bit personal, so we're happy to answer any questions that you might have about the products or suggestions or questions you might have. Thank you.
Yes, thank you for having us.
Thank you.